I'm Kate Pangborn from the Institute for Transport Studies at the University of Leeds, and I was very kindly invited by the conference organisers to moderate this session, which I am very, very happy to do. This session is the Walking to Win in Public Health and Planning, and we have, all being well, 5 speakers, 4 are in the room, and we also have Amy Aguiar-Javert online. She's waving at you. Yes, hello. And she will be speaking last. Due to some of the issues we've had with the technology this morning, question and answer between the room and online speakers isn't really possible. So what I'm going to say now is that if you want to follow up, get the email address from the programme or the organisers or from the slides and contact Amy at the end. Maybe Amy, you could put it in the chat if that's possible. But without any further ado, I'm not going to give lengthy biographies of any of our speakers. Our first speaker is Siobhan Hamilton from the National Transport Authority, who have been so welcoming this week. And she's going to talk to us about walking interventions to increase active commuting. So please welcome Siobhan. Thanks, Lee.
So good afternoon, everyone. Welcome to the first of 5, I'm sure, will be very interesting presentations. So my name is Siobhan Hamilton. I'm the Smarter Travel Programme Manager at the National Transport Authority. And the Smarter Travel Programme is a behavioural change programme. And I just want to give you, and part of that is these, walking challenges that we use to encourage walking on the commute. So just as a lead into that, I'll just give you an overview of the Smarter Travel Programme. I was told to have patience and wait until the slide.
Oh, just point in this direction to the receiver.
Thank you. So the Smarter Travel Programme, so what we do is work with large employers and campuses across Ireland to implement work-based travel plans. And what we're doing is helping those organisations to facilitate and encourage staff and students to have an active commute, sustainable commute to campus or to the workplace. So the benefits of workplace travel plans are reduced parking pressure, obviously, and then supporting an organisation's sustainability policy and supporting the health and wellness agenda for staff and students. And again, it's getting those organisations to consider how they can help staff and students to have a sustainable commute to their locations. So that's just a sampling of our partners nationwide. There's over 200 partners, all the major campuses, many of the large workplaces in the private sector, the public sector, local authorities, the major hospitals. So a very good cross-section of organisations are partners in the programme. So the programme is funded by the Department of Transport, and how it works is that each organisation has a dedicated Smarter Travel consultant to take them through the steps of the programme. So that works through from starting out with an employee a baseline travel survey to gauge how staff and students are travelling to work or campus, and then what the organisation can do. So what would encourage you to have an active commute? So that might be saying, we'd like to have a walking group at work to encourage more walking. We'd like to have increased secure cycle parking to encourage cycling. So it is across all the modes, walking, cycling, public transport, carpooling, etc. So moving on to the activity challenges themselves, we want to make it fun and very important. So it's always team-based within organisations, and make it fun for the organisation to take part. Make it social, and then make it easy for people to do. So we have Marchathon that takes place every March, and then Walktober is going to start now on the 3rd of October. So just take you through the actual walking challenges themselves and how they work. So as I said, it's a behaviour change programme, and we use community-based social marketing And this is to encourage more active travel. And they do directly support the partners' workplace travel plan or their campus travel plan. And then overall, we're looking to see a shift in long-term physical activity and motion is important to us. So the specifics of the challenges are they're fun and free for organisations to take part in. They're always based around teams of 3 to 6 people to get them walking over the 4 weeks. And of course, then what we want to see is that continues on after the 4 weeks. They can track their steps on a step counter or an app, and that ties into a platform we have. And again, as I said, it's longer term. We don't want this just for the 4 weeks. We want that behaviour to change and to continue to change on forward. So how does it work? You wonder, am I talking about the this or am I talking? Okay, so all participants have. So all you need to take part really is to have an email account that you can log on to the Active Travel Logger. Then teams are created, so you invite your co-workers to join you. And as I said, it's easy to track. You just track your daily steps. And then there's a weekly leaderboard that we publish. So there's a national leaderboard which shows, people who are really going at it, people whose dogs are ready to drop at the end of the month because they didn't walk so many times. So people who really get engaged in it. And then each organisation has their own organisation leaderboard. And that's where the fun is within organisations. Sometimes the senior management team will form a team and then everyone in the organisation, all the other teams will try to beat that team. So different sorts of fun and crack going on within organisations. And then there's weekly competitions that we run as well to keep people motivated throughout. So these are just some of the resources. So to have a successful Walktober and Marchathon, we're dependent on the coordinators within our organisations to run it well, to promote it, to keep engaging staff throughout and then to follow up afterwards. So say, for example, one of our partners is eBay. So we want to help that coordinator at eBay, that eBay employee to run this, to make it as easy as possible for them to run Walktober within their organisation. So we have a dedicated website, steptown.ie. As I said, we have weekly competitions that we roll out, and then the weekly leaderboards, and we also have weekly prompts for them. So this will be the poster for this year's Walktober. So that's some organisations choose to post it, like the hospitals would like to post it around their organisation so it's very visible in A3 size. Others just post it on their intranet. Here's the weekly leaderboard that organisations can use. Then we have guides for coordinators and participants, so very easy to follow, easy steps to follow to assist them in running it. I mentioned the Active Travel Logger. That's the platform we use where everybody logs their steps, and that's how the leaderboards are generated. And then we have email templates and a social media tweet sheet that they can use. So it's really a toolkit that's handed to their coordinators within their organisation. So this is just some feedback on Marchathon and October 2019. And these are the top 3 reasons, benefits we see coming back time after time from participants and for the organisations. That, they need participants like to be part of a team, feel connected to their colleagues. And interestingly, we were just coming to the close of the Marchathon 2020 when we went into our first pandemic lockdown. And we wondered what would happen with Walktober that year. And the numbers were staggeringly high. And we think it's because people were working remotely and really wanted to connect back in, even though they couldn't see their colleagues or walk with them. And we had people on WhatsApp groups going out walking and talking. And so it was to connect with their colleagues and connect with the organisation. So it wasn't what we were expecting to see. We thought it would be a huge drop off. So this is just what some participants have said about Walktober over the last 2. So it gave me the motivation to get out. I like this one, made me get up from my desk at lunchtime. So, you see people that come to their desk with their drink and their food and just sit there and, read the news headlines or go on Twitter where you could be out getting some fresh air. Makes people feel good about themselves. And then that sense of camaraderie that I spoke about that we see time and time again. So these are the key metrics from October. So usually we get about 5,000 people taking part around the country from our partner organisations. We have 90 organisations signed up for Walktober. That's starting in October, on the 3rd of October. So it'll be very interesting to see how the actual participant numbers come out of that. So what we'd like to see is, 95% would take part again, and that intention to walk once Walktober or Marchthon is over. And then this is just the 11-year review. So this is from 2009 up to 2019. And we didn't, in 2018 we changed, we actually switched to a reboot your commute as a pilot. And it stayed as pilot because the feedback we got was, where's our step challenge? Where's the walking challenge? That's what we want to do. Because we brought it back swiftly. So those green bars in purple are what we're always looking for. What's the intention to walk on a regular basis after these interventions? And what's the intention to walk on an occasional basis? So in conclusion, year on year we get positive feedback from participating organisations and from the participants themselves. And it's just important to see, as well as creating awareness, we know this for behaviour change, there has to be actions taken as well, and getting people to change their behaviours to actions. And these interventions work very well at the community level, where the community is the workplace or the campus. So that's it. I think I may have just come in on the time there, Kate. So if anyone has any questions, I'm happy to take them.
Thank you very much, Dawn. That's really, really interesting. What an amazing participant level. That is really fantastic. Has anyone got any questions for Siobhan? We've got a couple of minutes for questions. Stunned by the success of this programme. Are there any questions online?
No.
Okay.
Thank you.
Yeah.
You didn't leave me hanging. Thank you.
So Siobhan, the active logger, the active travel logger and stuff like that, is that kind of it's not connected to devices or anything?
No, which we would love, but we just wouldn't have the budgetary reserve. And that was something that's come back in the feedback, can't we just have our Fitbit, automatically sync? But no, people, they have to go on and actually log their steps, and that's just the resource.
It's a real challenge, because we did something like that similar in just that joining the dots in terms of the tech is just really, really difficult.
Yeah, and it used to be that people used to fill in, like an Excel spreadsheet for their steps, and then they'd upload it through SurveyMonkey. So we've moved on somewhat, but it would be great to have, a platform that's synced with different activity trackers.
I add that in the Netherlands we have September.
Oh, right. Okay.
Yeah.
Really original.
And but they managed to have these activity trackers all integrated in their app.
Yeah.
So it is possible. Maybe they have a smart way to do it.
Yeah, maybe they do.
Yeah.
It's just that the software we use has to be proprietary, so we'd have to have it built in-house, and just the resources aren't there for that at the moment. Yeah. But I've heard September is a good one. Yeah. I think it is.
You'll have to have a third one now.
Back to back.
Every month we come up with a walking fund.
Yeah.
Thank you very, very much.
All right. Thanks very much, everyone.
So, second up, we've got Jose Vesely, which those of us who are paying attention will recognise from the panel session just now. And Jose is going to talk about how active mobility can serve public health. Please, I'll give you a 2-minute warning.
Thank you. So, thank you for attending this session, because I will now dive deeper into the project that I was mentioning earlier in the panel. We were hosting Walk21 in 2019, and back then we were walking with trees, which was quite fun to do. But more fun was that after hosting this conference, we were finally able to implement this very first walking strategy, allowing us to put the pedestrian on a pedestal and to create a walking culture in the city of Rotterdam. So these are the 3 main objectives of this policy document. And we found that our walking policy on an overarching level was relating to the cycling policy and our local health prevention policy. And because of this, we figured walking and cycling, it is the most easiest way to get this exercise, your daily exercise. So why don't we just team up and start a project? And this is why we were very pleased by this local family doctor who came up to us with this question. I would love to refer or prescribe my patients to something that has that relates to walking or cycling, but there was nothing there yet in the neighborhood. So this is a neighborhood. It is in the northern part of the city, divided by two major highways. So this is the context that we're working in. 55% of the residents there are facing obesity issues. So we do have something to work on. So talking about connecting the silos, we started this project. I was coordinating the project. I'm working both in the walking team with Karen, who is our program coordinator, and the cycling team. And we teamed up with the health department. And still, colleagues are asking us, how do you do this? It feels a bit weird, but we connect. We do have some common grounds. And I believe that there always is a common ground to start a project with colleagues. And not only with the health department, but also with the local community. This is the dream of the community, the local manager. And the guy on the right-hand side, he is a coach in this well-being and welfare organization. I'm not sure if this is the type of organization that you're familiar with, but they work on a local community level. They know the people. And for example, he walks 30 minutes a day with a group of people that are willing to. So we were trying to connect our projects to the already existing activities in the neighborhood to strengthen it. We also went out to the market to just ask people what moves you, what makes you go out for a walk or for a bike trip. And it turned out, and we were actually not really surprised, that green was the main asset, the main trigger for people to do this walk in their neighborhood. The only thing is that people are not always aware of these beautiful and attractive places that they have in a short distance from their homes. At the same time, in another neighborhood, there was already something in place, which is called the Green Connection, an 8-kilometer walk through the neighborhood, connecting different green initiatives. And also interesting in this, the local GP in this neighborhood, who was actually a keynote speaker in our conference back in 2019, he walks with his patients every Thursday afternoon. But obviously, this is something that not every family doctor is able to do. So this is why we are now trying to connect our projects to this health department. And crucial in this is collaborating with the local stakeholders. And by mapping the neighborhood, we are creating awareness because we organize workshops with the people themselves. And it is just a means to connect a network of both places and people. And in the meantime, it is kind of starting a movement in this neighborhood. We have lots of organizations on board. For example, the one in the middle, which is the National Nature Conversation of Nature Organization. I'm still struggling with the same word as I did before. But also local allotment associations. They now want to open up their area because there's lovely walking routes through their area, and they would love to open up to public. So they also connect to our project. There's a museum. There's also the local cyclist union. So this is a group of people that we have now started to connect to the project. And we started to organize workshops. And these workshops were hosted by the initiators that are collaborating with us. And this is also a key thing to create support. And here you see us drawing on a map. This was a week ago. It was still beautiful weather. And it was hosted by this beautiful estate just outside of the neighborhood where we are running this pilot. And we just showed them what we have gathered in the workshop before, let them reflect on that, add more things, maybe add more organizations or people that they think should be involved as well. And this is to show you what the process is like. In the end, it's all about happy faces and happy people making a project together. The project, by the way, we are now calling Green and Healthy Mobility with the Neighborhood. And this is essential in the process, that it is a collaboration of all these different groups. This is where we are at now. The map is still in a draft version, but we are now working together with the graphic designer of this right-hand side map in order to create a kind of a family of these maps throughout the city. So people will start to recognize the concept. And we've also figured that it has become a successful concept because other neighborhoods are coming up to me and my colleague because they also want the process and the map like this to start a movement in their neighborhood. Interesting to mention, we are starting bottom up. We are creating this network, but at the same time, this is a tool, also a means to address the focus for investments in the physical environment. So this is a route that the local walking group that I was just mentioning walks every day. And we just talked to the maintenance department and they were able to straighten the tiles. And it is as easy as that. And this is, again, a key thing to keep them aboard because they don't really like just talk. They want to see results as well. One of the last slides, in a few weeks, an urban gym will be opened in a park in the same neighborhood. And this will also be one of the points of interest on our map. And when it's opened, we are planning to organize a small event, because this is what the map is also a means for. It is a starting point to organize activities. So all those people you saw on the picture with the happy faces, they will go and organize activities for walking groups or whatever. And we'll make an event calendar that will connect this map. And this is, as I said, part of creating this movement. We started this in this specific neighborhood in the northern part of the city, but as I said, we've seen that there's a lot of interest in other neighborhoods as well. So we are thinking to upscale the approach. And the approach is about connecting people to space, social infrastructure to physical infrastructure, teaming up with a group of key stakeholders of both the community and the municipality, creating a map together, let it become their map, and then start organized activities and interventions. And as soon as this map is coming alive, we are also able to address investments in public space. So it's just about get the ball rolling. Thank you for your attention.
Very much. That was great. There's lots of things to remember there. Very, very good sort of hooks for our memories. So particularly connecting people to place, which I think is such an important thing. Has anyone got any questions that they would like to ask? Is there anything online? No. Okay. There's a couple over here. I don't know who went up first. Go for you.
Yes, thank you so much. That was really interesting. I love the graphic design of that. The leaves. It's really catching I'm definitely going to remember it. So thanks. I'm just wondering, so you work for like the equivalent of like a city council, is it? It's a local authority.
Yeah, the city development department.
And your urban planning background. The reason I'm asking, I'm just wondering, is the motivation from this from a public health perspective, or how did this kind of motivation for this project come about?
It actually came all together because on an overarching level, we kind of have the same objectives.
Yeah.
And we figured that this specific project could be triggered to start a collaboration because this is not a common thing to do.
Yeah.
And it was because of this question of this family doctor, and then at the same time, we were already thinking about doing something together. So sometimes it just comes together. It's great.
Thank you, next.
Yep. Hi, my name is Kevin Wall from the Department of Public Health here in Dublin. I just noticed on your map there is what looks like quite a large airport next to the neighborhood. I'm just wondering, have you noticed any kind of impact of the noise or kind of activity of the airport on public health and the walking and the enjoyment of the walking in that suburb?
Yeah, in some areas there is problems with noise. You know something about it maybe because there's
there's a group of people in the neighborhood who have proposed an idea to make the airport, to close down the airport and make it a large park and put houses around it. So these houses on the border of Rotterdam are at a park, at a large park. And it won't happen because our coalition in our council they think the airport must stay, but there are people who want to have it away and make it a green space.
Yeah, because they are facing these issues.
Yeah.
A radical solution on this.
I think there was a question.
Yeah, just want clarification. You mentioned there was another doctor who was already bringing his patients on a weekly or a daily walk.
Once a week.
Once a week, and that's just another family doctor in the area doing that. But that's quite innovative, isn't it?
It is, yeah. He invented this. I believe in the UK it's called Walk with a Dog.
Walk with a dog.
Yeah, and he started this concept in Rotterdam. Walking recipe.
Yeah.
So we have social prescribing here.
It is like that, yeah. But the thing is that he has a busy schedule.
Yeah.
So what we are now trying to do, because this is an exception, he is such an enthusiastic guy and he will keep on doing this. And there's so many other doctors who don't have the time, and we want to develop something similar for them, and then connect it to this local well-being and welfare organization because they are responsible for well-being in the community, and we can connect it to their assignment.
So that's that coach person who brings the groups every day or
every day, not himself every day, but there's walking groups every day
that people can just join whenever, like.
Yep.
Right.
Yep.
Yeah, that's good. Thank you.
We've kind of run out of time. Can I ask you to catch up afterwards, if that's all right? Maybe we'll have a bit of spare time at the end. That's what I'm aiming for, so we can have more questions. Very much. Thank you. Okay, next up we have Ruth Gow from Bats and Company. And Ruth is going to talk to us about Healthy Cities Generator. Let's read it blank. Automating healthy urban design, which sounds intriguing.
Thanks. Yeah, so I'll be presenting the Healthy Cities Generator, which is a tool we've been developing at Maxim Company to help anyone interested in getting to the heart of healthy urban planning. We've already heard from so many people today that our health depends on so much more than what the healthcare system is concerned with. So we have that actually up to 75% of people's health depends on the space and the environment in which we develop our lives. So for more and more of us, this tends to be in cities. And interestingly, in a study that was published, a study by IS Global from a few years ago, found that if the WHO recommendations for levels of physical activity, pollution, noise, heat, and green spaces within cities were followed and complied with, we could be preventing up to 20% of premature deaths in cities. So there's plenty of evidence that backs up this link between the environment and our lifestyle and our health. A few examples, we've already heard a lot, obviously, about walking. So walking for half an hour a day can have a really big impact on both our physical and mental health. But also other things, though, that are in the places where we live. Green space, or having access to green space within 500 metres of where we live, not only encourage to increase our physical activity level, but also can have quite some impact on a full series of other mental and physical health. So what do we need to look at when building or designing healthy cities? Really quite a lot of things. We see in this diagram now where we have at the centre the SDG 3 for good health and well-being. And we can see, in fact, that it actually relates back to almost all the other SDGs. No? So if we actually want to work in health and reach these goals and make an impact, we really need to work across departments and across sectors. So we're seeing this in the health in all policies approach that are starting, and also at urban level with the urban agenda for the EU, how they all try to work in this sort of more integrated way to achieve their goals. And we think, so the urban planning can be a tool for health, precisely by embracing this cross-sectoral or cross-departmental perspective. We can have urban planning impact mobility, green space, public spaces, the types of uses and facilities that are around us, the availability of housing, even air quality. And by working with all these things, we can actually make urban planning a health generator. So when we first started thinking about this, we sort of wanted to make this as easy as possible, no? So that urban planners in their day-to-day could easily integrate health into the planning process without actually adding to the complexity that they all face already, you know, in many aspects. So we really wanted to bridge this gap between what we know and what we do. So we looked into the scientific evidence to find out what is it that we know, and we reviewed literature that had been published between 2015 and 2021. So all this literature that linked different aspects of the built environment and the urban environment with specific impact on health outcomes. On the other side, we really wanted to see what we do. So how can we actually, or how are we currently applying all this knowledge? So we looked into various frameworks, guides, and checklists to find out how these were being used at the moment. Throughout the whole process, we also held quite some meetings with different institutions, so both from the local level in Barcelona, where we were based, also some other national and international bodies, which really helped us identify the needs that they were facing and define the challenges in their work every day. When we looked into the usability of tools, on one hand we looked into frameworks and checklists, mostly to see how they were actually applying the criteria and how they were being implemented. But we also focused a lot on tools, so more interactive resources. And here we looked at 4 things. So we looked at the depth of analysis that they offered, the scope, how easy they were to use, and also the number of, or the amount of data that was required from the user to be able to use each tool. And what we found here was that while, there are quite some tools that are fairly easy to use and address these different health factors in depth, they tend to be focused or limited to only 1 or 2 health factors or settings. There are some other tools that do offer an in-depth analysis on a much broader scope of health issues. However, these tend to be significantly more complex to use, are more time-consuming, and also require quite a lot of data to be gathered and entered beforehand by the user. So we identified this gap, and this sort of shaped the direction that we then followed when developing our tool. So we knew that we really wanted to keep both urban planning, the urban environment, and health really at the centre, and also focus on both in a holistic way as possible. So from planning, focusing on a whole range of different topics, mobility, greening, and blue spaces, amongst others, and then also seeing how all these different features of the urban environment could impact a whole range of health outcomes. So from the scientific evidence review that we did, we identified all these aspects from the built environment that from urban planning we can impact. We grouped these into 5 categories of what we call the urban determinants of health. So first we have density, relating to compactness of cities, mobility also to connected cities, focusing a lot on if they're walkable and cyclable. Variety, so what if we have a range of services and facilities available in our neighbourhoods. Landscape, so green and also blue elements being present in the city. And lastly, housing, if we can offer quality and affordable homes. So we then established how each one of these different aspects impacts our physical and mental health directly. But we also took into account all these different other factors that also play a big role in our health. And we're aware that all these different aspects of the built environment can also have an effect on these, so more personal, economic, social, and most importantly as well, environmental determinants that then again impact our health. So by knowing all these links, we are now able to take an urban plan and see how the different actions that are proposed in this plan will affect all these different urban determinants of health, and we can then translate this into a concrete impact on a whole range of health indicators. But as I was saying before, we really wanted to make this work both from the planning side and from the health side. So we wanted to make sure we could also start by identifying some priority health indicators that might be an issue in a certain neighbourhood, take these into account, and then see which aspects of the built environment, which urban determinants of health we needed to address to tackle these issues. So with this information, we can then move on to the urban plan and help shape and influence the plan scope to deal with these issues correctly. So this is the tool itself. We can input the different actions that make up an urban plan and evaluate them here. But what I think is most interesting is in the first results that we get per action, we can already have what we see in the spider diagram, sort of the scope of the urban plan and the different actions that are planned. So we see sort of the impact that it has on all these series of features. This can tell us a bit if the plan focuses a lot more on greening than it does on promoting mixed use, for example. And then we go to the health indicators. So here we can see we assign values to each one of these different health categories, which are environmental health, physical health, mental and well-being health, and also lifestyle. And then in the results page, we can see in a lot more detail the combined impact that the whole urban plan will have. And we get a detailed insight as well into more specific health outcomes. So for example, for the physical health, here we can see in terms of obesity, type 2 diabetes, and so on. So who is this for? Very much for urban planners and health professionals, as we've seen, but we also think it would be very valuable for decision makers to help them back up and also better communicate their decisions, for citizens to engage them in the whole planning process around health. So this helps them also really see the benefit or the impact on them directly. Local government to what we saw earlier, to really actually help bring together these different departments around these topics. And lastly, also for innovation projects, so we can assess the impact of more specific interventions for maybe nature-based solutions or some case studies. The Vic, which is a city in the north of Barcelona, was sort of where we first tested out this whole methodology, and it actually won an award, a national award for urban planning, for being one of the first of its kind to recognise health as sort of a central aspect and tailor plan around it. In the Healthy Cities Network, which is part of the URBAC programme, we also tested the tool out with the 9 cities that were involved. Recently, we also worked with Wirral in the UK, so they had a master plan of regenerating a specific area, and they were really interested in testing out different options and comparing, the health impact of each one to help them make a decision. And lastly, in Barcelona, so close to home, we're actually still working on this. The city council is implementing the green access strategy, so they're really working on transforming 4 main streets into much greener and pedestrian-friendly areas. So we also here carried out the health impact assessment of there. The tool, which I've showed you just now, is sort of the current phase that it's at, but it's something that we're continuously working on and still developing and updating. And we're always really interested in getting other people involved as well. Some things that we set ourselves as sort of next steps that we'd like to improve or integrate into the tool are to incorporate more social health indicators, so focusing on other aspects that also have a big impact that the urban environment can impact, such as gentrification, gender and safety. We would like to make it also applicable on a more global context. And lastly, we'd really like to focus on improving its usability to make sure it's also accessible for use with citizens. This is the team. We're based in Barcelona, as I said, and we have experts in a whole range of different fields that are involved. And that's me. Please get in touch if you're interested. We also, on our website, you can actually access the tool. We have an online version, so you can play around with it there if you have any questions.
Ruth, that was really fascinating. I love dashboards and spider diagrams. So we have time for one question, maybe two if they're both short. So, yes, sir.
Yeah, hi. In May 2021, Spain set a national 30 kilometre per hour limit for towns and villages. I would like to say how much that has helped in setting or creating healthy environments.
Probably a great amount. One thing I was thinking is, at the moment in Barcelona, they are indeed implementing a whole range of different measures and policies. We never actually see health as the main objective, or it's not at least communicated in that way. But I think all of these things, as you were mentioning, like the speed limit, obviously do have a great impact on health. And I think it's also important to make sure that people are aware of this and that these different policies that they're implementing actually have a great benefit for people.
Thank you very much, Ruth.
Thank you.
Catch Ruth afterwards. Okay, our penultimate speaker is Martin Wedderburn from Wedderburn Transport Planning, who will be, the title is Healthy Movement, Healthy Places, Measuring Wellbeing and Quality of Life Impacts in Transport Appraisal, which is a very important topic. So take it away, Martin.
Thanks very much. Yeah, my name is Martin Wedderburn. I've been working in the field of transport planning and walking strategy analysis and appraisal for about 20 years now, actually. This is work we did for Midlands Connect, and I have to say at the beginning, these are my opinions, haven't actually been published yet. Those of you who don't know, I said this morning as well, Midlands Connect is a subnational transport body. We don't have regional planning in the UK. we have bodies that coordinate things around regions and do research and developing conservation projects. The background of this piece of work, we love appraisal in the United Kingdom, and actually a lot of English people seem to love it. A lot of it is still dominated by travel time savings. These actually occur. We do also look at societal impacts. We have values around data reduction, carbon, environmental, physical activity, social distribution impact assessment, and some appraisal people also love to look at wider economic impact as well. Increasingly, the economic narrative and the bottom line is much more important than in business cases. But as mentioned, it's also an interesting time to be involved in that because Wales has its own appraisal guidance. It's actually just thrown away this top bar, or thrown it away. It's put severe caveats around it. So it's a very interesting time to be involved in this field. But why was Midlands Connect interested in this? Well, they've traditionally been looking at large road and rail schemes at the regional level and so on. But actually, a lot of what they're looking at now is guidance from local authorities about quality of life, place, and so on, and they need to change the way they start to raise projects. So they commissioned work into health and wellbeing research in this case. I'll start quickly by talking about health. Key measure that is used across different government departments tends to be quality adjusted life years, which I'm not going to go into detail, but it's essentially a measure of length of life, but also quality. Lots of ethical issues about how you calculate qualities and so on, but just to say, there's things called multi-attribute systems, which makes that a lot easier because you break it down into components, quality of life, and so on. In the UK, in terms of health valuation, we've typically, for a very long time, used the value of life, which is a cost factor related to both human suffering from death or injury, the loss of output by a person, and the actual direct medical costs. That's been used for quite a long time, and that has then been used to create a standard value per quality adjusted life year, which is actually a common economic measurement used across the departments. So, well-being and health. Lorraine actually said in her speech that the World Health Organization definition of health was personal, social, and mental health, but actually used the term well-being. So defining the difference between health and well-being is actually not that easy. But the Treasury in the UK is actually seeing well-being. So subjective well-being, part of it is quite well defined, which means how good we feel about our lives. And there's 4 questions known as the ONS4 used in several panel surveys in the UK to define our well-being. It's evaluative, how satisfied we are. There's a short-term positive negative effect, how happy we felt yesterday or anxious we felt yesterday. And there's people that are mnemonic, to what extent do you feel the things you do in your life are worthwhile? Now, there's a load of criticism of too much focus on these 4. It's too much life satisfaction and ignores factors such as autonomy, competency, and so on. But they have been used for many, many years in many, many panel surveys. So they're a great source of longitudinal data. So they have positive and negatives. How do we go value it? Well, the Treasury has to value everything. They thought, well, the quality is all about not the absence of negative health outcomes. They wanted a measure that's something to do with positive well-being outcomes. So they tried to put a value on the well-being, which is on a life satisfaction score between 1 and 10. They tried to base a value on it, and they're encouraging other government departments to move from equality, absence of health, poor health, to well-being outcomes, and actually use that in their evaluation. So, for our research, we looked at transport and built environment, and health outcomes, well-being outcomes over 9 pathways. Part of it was to look at where we could use health and well-being outcomes in a different way in the transport appraisal. We used logic mapping, going from transport built environment interventions, switch direct outputs, impacts and outcomes, and evaluation method at the bottom. And we looked in a targeted review. This wasn't a systematic review, I have to say. This was a consultancy study with an academic peer review panel, and we used criteria in terms of what we thought was probable, plausible, aspirational. If probable, it had to have multiple, preferably meta-studies, backing up the findings, evidence of causality, proper control groups, and so on. Correlational evidence with reasonable control groups could be classed, of course, sometimes quite reasonable high thresholds to go in there in these logic maps. So we looked at 9 pathways, wider than some of the traditional sort of health. So physical activity, yes. We also looked at labour market and productivity within the well-being lens, connectivity and travel choice, social impacts, quite wide, accessibility, focusing on disabled access and personal design, journey and neighbourhood quality, measured, environmental impact, road danger, and personal security. The first finding was actually how much health is already used across government plans to measure and value a lot of this. So physical activity, yes, we all know about links to the health outcomes, which was mentioned now. Sort of slightly greyed out ones, connectivity, social impacts, journey quality. Insofar as they generate more physical activity, they also have a health outcome. Universal design, link it directly to multi-attribute systems if you want. It's rarely done because you don't necessarily need to place a value on it because there's a legislation that says we have to do it. That way if there's something new, but you could do it. And interestingly, damage costs for air quality, personal security, and road danger, they all use variations of qualities and still value of life with their own appraisal procedures as defined by the Treasury as well. So it's widely used already, was one thing to be noted. And we looked at 2 areas we thought well these would be potentially a very small quick win where it could be. So one is an enormous amount of evidence about employment as a well-being. So being unemployed has a very good negative impact on well-being. There's no normalization. In fact, the longer you're unemployed, the worse your well-being becomes, and it has an impact on your family, your household, etc., etc. Very, very strong evidence base there. And if we look then from a transport spatial perspective, if you have people on low incomes who may not have access to a car, but a lot of your, let's say, re-employment, entry-level employment is in places like this, then this transport is a barrier to re-employment. If you can overcome that barrier, then a well-being measure could be a way of appraising making the case, either for not building this and using the land use planning system to put employment in sensible places, or in terms of if you have this, providing alternative active or public transport means to get to places like this. The second example where there's very, very strong evidence is around loneliness. So for about 40 years ago, they looked at loneliness specifically and found that social networks are really, really, really strong determinants of well-being. So control for loads of confounding factors, but it still stacks up. And I think that one statistic, it's similar to things like smoking. So it's a single explanatory factor in terms of well-being. And here, I think a lot of work's now being done. There's currently a lot of pilots happening in the UK that are being evaluated in terms of what is the role of transport in overcoming loneliness. And and this is definitely a transport issue, and it's both about transport that can overcome loneliness, but also land use planning. Naturally, it's losing the post office, which is just as important as the bus to the post office next.
So I think this is one area where health and well-being measures are really important.
This may be the low-hanging fruit. There are wider research issues for us in the community of transport planning and walkability. People, confidence to travel independently is a big issue across many of the literature we looked at, and it's very complex and multifaceted. Because that then leads to physical activity, social integration, and so on. But these barriers are complex. We tend to focus too much on the commute. Don't look at, there's very little structured research about what, we look at carers and parents, very little structured research about what are the conditions under which people will allow children not be in their care, children, and so on. And that's part of the focus on the community. So this is an area that needs more work. Overall, we tend in social sciences and transport planning to a lot of cross-sectional data. Health specialists, they need more longitudinal data and natural experiments. We have an issue with self-selection bias in transport planning a lot of the time, because we look at people who might move to a place because they like to travel, facilities there. The health sector would like more, actually, where they're random. Natural experiments, examples would be if you target people who might be moving to a certain school or might be moving to a new development, then you have people who do move there, people who don't, and you have a natural control sample. That's the kind of evidence they want. As I said, there's a lot of existing panel surveys with well-being data already in it. We can use enhanced spatial neighbourhood environmental variables, back up some of the panel surveys of longitudinal data that go back many years. That's another opportunity we have. In terms of the walkability community, there's lots of evidence actually about access to green space, dense, compact cities, and eyes on the street, and personal security, all being good for their health and well-being. But a few caveats here. A lot of this stuff was in the plausible middle category, not the probable, because we have a huge number of different tools for evaluating walkability and neighbourhood environmental quality. And all of these meta studies came out and said, yeah, on the balance, it's probably okay, but actually it's all completely inconsistent. And we've had there's been at least 17 audit tools mentioned at this conference already, as usual. It's a big issue. And also the dose response issue. Just because someone lives in an environment doesn't necessarily mean we know how much time they spend there. So all medical research always has this issue of dose response. You have to say, yes, they live there and they spend X amount of time. So that's a sort of call to the walkability community to up our game in terms of the big players and these things that can be used by practitioners. And that's just really the team. Big thanks to peer review team, Dr. Adrian Davids and Dr. Jamie Anderson. And to Walk21 actually helped them push.
Time envelope there a little bit, Martin.
Sorry.
And I really thought that you were going to get to the end without mentioning anything about walking. So thank you for putting the walkability in there at the end.
The whole purpose was to make it.
Yeah, okay. So one question for Martin and then catch him afterwards. So we've got anything?
I think it's not so much a question, or a comment to the slide about transport and social activity and the given in Ireland we have the last couple of years a number of our local post offices promote rural communities goes down, but that piece around you take one social space from the community, you need to, and you expect to go elsewhere. You need to put in this sort of resource. And over a lot of work, a lot of development happening in terms of links and transport networks. But, you know,
We don't need to just older people as well. The travel survey shows a reduction of numbers of people. And
It's not a non-trivial issue. Yeah, okay. Thank you very much, Martin. Our final speaker today, after an incredibly interesting day, and this is a great follow-on from Martin's topic, and also from all our speakers, is Amy Aguiar-Javert from the OECD, who is going to look at the Irish transport system through a well-being lens. So if you're ready, Amy, please get started when your slides have appeared for you. Are you able to unmute yourself, Amy? We can't hear you. Yeah. Sorry about this. What's happening? That's very rapid typing. Yeah.
You did hear them, right?
Yeah. Have you tried clicking that?
No, I don't have permission on mute, unfortunately. She must do it herself.
We do the old-fashioned turn her on.
Yeah. The comment from the floor there was, can we turn you off and on again?
Yeah.
We've all learned there's lots of weirdness in the internet world over the last 2.5 years. So maybe we should do it first when it was working.
Yeah.
We got you yet? Oh yeah. She gone?
She has again, yes.
Settings button, at the bottom have audio settings.
just for me, not for other participants.
Okay, this is unfortunate. We'll give it a few minutes. Thank you for being patient. Hey, right, we've still got a mute symbol. Whose cursor are we seeing? Is that yours? Right. The volume isn't the problem. The volume button there, no, that's not the problem.
No, it's not. Yeah. Thank you, though.
The person who had a question for Ruth that couldn't ask it. We can ask it now. Interesting.
In Rotterdam, and the neighbourhood is a mix in terms of demographics and social kind of quiet areas and mixed inner city kind of high-rise blocks type of areas.
There's not a lot of high rise. There's a lot of elderly people living there.
Yeah.
And it's on the outskirts of the city. So it's within a 15-minute cycling route to the city center.
Yeah.
It's not a deprived neighborhood. No. But we are now also conducting this in another neighborhood, which is more deprived, whereas it's lacking green. Yeah. Because we figured those are the neighborhoods that deserve this the most. Also to invest in more green land.
And is there in the Netherlands, is there a difference in terms of demographic socioeconomic groups in cycling and walking? Is there lower levels of cycling and walking in the lower socioeconomic groups?
Yeah, there's a difference also between cycling and walking. And in Rotterdam, it's different from the other big cities like Amsterdam or Utrecht. There's way more people cycling there.
Yeah.
And in the southern part of our city, where the more deprived neighborhoods are located, there's more people walking than cycling. Right. Yeah. Okay. They can't really afford a bike.
Okay. Yeah. Okay, thanks. Just interesting to see the difference and how it would be replicable then. If you're taking it to city level, would it the same thing work in a, I suppose, more young urban area or more high-rise block areas?
Yeah, well, it's not a blueprint, but it's more of an approach.
Yeah.
That when we connect it to another neighborhood, it will be having a different outcome. And we also connect it to, for example, in these neighborhoods in the southern part, we want to connect it to the bicycle program to also offer bicycle classes for those people who don't know how to ride a bike.
Okay, thank you.
I'd like to ask Ruth a question, if I may. Ruth, when you were talking about high density being good for health, Is there a threshold over which you shouldn't go before it becomes the opposite?
Yes, we're actually working a bit on reviewing the naming because we actually don't refer to density as high density necessarily. There is definitely like a level where it becomes too much.
Yeah.
So yeah, there is a range, although we're slightly hesitant as well to add specific values because it depends a lot on the context and what you're. Yeah, it's confusing.
I think we were all following the chat. I think what's happening is that Amy's being emailed a link to try and come in again. We'll just carry on this interesting discussion. So.
We can ask your app, the generator, what level of data do you need to plug into it?
None.
Okay.
So that was sort of one of our objectives with this is that we don't actually need any specific data on urban. I mean, we need a lot of information, but not numeric data, so to say. So we have sort of in the back end of the tool the data that links the impact to the health indicators. But it's very much the user that has to establish the different actions that are included in the plan and evaluate themselves the impact it will have on, for example, improving the street connectivity, improving walkability. And what we do have for each one of these aspects is some guidance on things that we should look at. And for example, for density, we do offer like a range, so it should be between 50 and 150 dwellings per hectare, which is obviously quite large. So we do offer these sort of keys or like things to help people properly assess their plan. But we didn't want to sort of measure it in any way that would then maybe make it less useful in some cases.
So you don't need, when you look at health impact assessment stuff before, sometimes one of the challenges is like plugging in lots of, area specific data on health indicators or country specific data and breaking it down. So you don't need that because you've got algorithms in there that do all the information.
Yeah.
It's another presentation. I was just wondering, you mentioned at the end of the presentation about a number of case studies, pilot studies we have run in different towns and cities, and I was just wondering if you got some feedback from the users in these cities and towns about, how useful they found, how feasible these kind of things.
Yeah, definitely. Actually, interestingly, the last one I mentioned, so the one in Barcelona with the green accent, was the first time where we actually worked with it was the public health agency from Barcelona. So we were speaking directly to the health professionals. And all the other cases that we've done, we've always been talking to the urban planning team. So it was really interesting because actually at first there was quite some misunderstanding, and it was like made us think a lot as well, like how important it is like this language and how we communicate as well. So yeah, and then from the others, it's also been very interesting applying it in different contexts as well. So we had one in the UK, and another quite similar one in Spain, so quite near Barcelona as well, which actually I didn't include here, but they were fairly similar in the scope. They were both like sort of trying to regenerate a certain area, mostly at the private area actually in both cases. And it was really interesting here to see as well just how it works now in the different countries and actually what is more important for the planners in some cases than others. And also just what they're looking for, not from the scope. And so, yeah, a lot of interesting. And it also really helps us sort of just continuously keep working on the tool, because every new assignment we get, we sort of find out, this is also really important.
Will it be an open source tool, or will it be?
At the moment it is. You can access it on the website. The only thing is this version is open to anyone, so you might use it and the day after go back and it'll change to someone else's has access to it. We're working on developing a more sort of user base, so each user can create their own project and have their own workspace and work there.
It looks like Amy's not been able to rejoin. The platform, the background platform provision has been having some problems today, in which people can join but not take part. And it seems a bit random as to who is affected and who isn't. So we have a hard cut-off at 5:30. So I think we're going to have to call it a day, unfortunately. I'm very sorry about that. I know it's so bad when we have a hybrid meeting and the person who's participating in the hybrid way can't actually get through. But maybe there will be a way of the conference organisers helping her to get into one of the other sessions that are going to talk to them. Hopefully you've enjoyed our 4 presentations. I certainly have. There's been a lot to take away. They're very inspiring success from Siobhan's example. Lots of thought-provoking things coming from Rotterdam. The work that you're doing with your tool, which is really quite exciting. And Martin's quite thought-provoking challenges there about what we're not properly looking at research community. So we'll take that one away. And hopefully see you all at the dinner and during the rest of the conference. Please give everybody a big round of applause.